Medicaid supports the health of America. It provides essential insurance coverage for many across the country. Medicaid also indirectly helps those it does not insure by promoting stability in the healthcare systems everyone uses. President Johnson's advocacy and signature created Medicaid and Medicare in 1965. Let's learn more. Everyone starts learning somewhere. Let's dispel two areas of confusion. Medicaid and Medicare have similar sounding names. Both are forms of insurance created by the same law, but they are not the same. Medicaid and Medicare generally insure different people, although there is a smaller number insured by both. Also, states often call Medicaid by another name. Some may be insured by Medicaid and not be aware of it. Ask someone in your state if Medicaid has another name. Please do not be confused. It is still Medicaid. According to a July 2024 report from the Centers for Medicare and Medicaid Services, more than 72 million Americans, or 20% of the U.S. population, is Medicaid-insured. Medicaid is health insurance paid for with state and federal taxes. Medicaid is provided in partnership between federal and state governments. The partners are responsible for different administrative duties. They share costs to make the insurance available nationwide. This December 2024 explainer provides an overview of what Medicaid is, who it helps, and how, using cited information. The explainer does not address details of any state's Medicaid program. Please review your state's Medicaid program for local information. If you have questions about your situation, please reach out to a local expert. People can apply anytime for Medicaid in the state where they are a resident. Medicaid does not have an annual open enrollment period. In the Medicaid partnership, federal partners are responsible for deciding which healthcare service must be covered by all states. These are called mandatory services. Federal partners also determine the choices states have about service coverage. Services that states can choose to cover are called optional services. Another national decision is the definition of economic need, a federal criterion to qualify for Medicaid. The process of becoming qualified is called eligibility determination. Federal partners also oversee demonstration projects, monitor state program compliance, provide guidance and assistance to states, and gather, analyze, report, and present information and funding requests to Congress. States oversee the eligibility determination process. They can choose to add other requirements to determine who will be Medicaid-insured. Medical need is a common additional requirement. Some states have a centralized application and eligibility determination process. Others collaborate with counties or contractors to review applications and supporting information. When determining eligibility, when someone is Medicaid-insured in one state and moves to another state, Medicaid coverage is not transferable, which means the insured person must reapply for coverage in the new state. Medicaid-insured people must provide information to the state if their income changes, when the change happens to determine whether they remain eligible. Also, each year, all Medicaid-insured people must provide information to the state to verify their continued eligibility for coverage. This annual verification process is called redetermination. Periodically, each Medicaid-insured person must completely reapply for Medicaid coverage. This periodic process is known as recertification. Depending on medical need, the Medicaid-insured person may need to participate in assessments and have home visits. In 2022, Medicaid accounted for 18% of all U.S. health spending. It paid 19% of all hospital costs nationwide that year. Medicaid is a significant cost within state budgets. Still, it's a good value for the states, especially those where residents earn less than in other states. The federal government pays a higher percentage of the cost of Medicaid in states with poorer economies. This supports local stability in medical and health systems that benefits everyone. It's a myth that people insured by Medicaid are not working, excluding those who receive supplemental security income, and those who are insured both by Medicare and Medicaid. Data reported in 2022 shows that, of those Medicaid insured, between 19 and 64 years old, 61% are working. Medicaid supports the health of rural America. 14 million Americans living in rural communities are Medicaid insured. In 2021, 17% of all people in the U.S. with healthcare paid for by Medicaid lived in rural places, according to the Medicaid and CHIP Payment and Access Commission. In fact, coverage rates in rural areas are higher than other areas. More than 1 in 4 Medicaid-insured Americans are women and girls of reproductive age. Medicaid pays for 41% of all births in the United States. The U.S. Supreme Court decision in the Dobbs case overturned Roe v. Wade and 50 years of precedent. The finding likely increases the unmet need for coverage of prenatal care, birth, and maternal child health. America's future, competitive edge, and position in the world depend on how we prepare our children and whether they are secure. In July 2024, the Kaiser Family Foundation reported that 39% of America's kids are Medicaid insured. A growing body of research shows that investing in the health and well-being of children from birth to age 5 can lead to improved health, educational attainment, and earnings in adulthood. Medicaid supports the nation to accomplish these outcomes. Again, the Kaiser Family Foundation reported 16% of U.S. adults ages 19 to 64 are Medicaid insured, according to research published in July 2024. 43% of Medicaid-insured people in the U.S. have disabilities. The unexpected happens, whether at birth, through illness, heredity, or mishap. Many people are disabled. That term, disability, includes a wide range of experience. Some disabilities are evident. Others that affect daily life just as much are not visually apparent. Consider the people in your life. Do you have a grandchild with autism? Maybe a friend from high school acquired a spinal cord injury. Does your neighbor have schizophrenia? Perhaps your brother experiences addiction. Disability is part of life for many. America does not require private insurance companies to cover the full range of medical care and services that many people with disabilities need to be healthy and participate in society. While the rate of labor force participation is lower among people with disabilities than the general population, those who are employed are twice as likely to work part-time than their peers without disabilities. Even when someone with disabilities is insured at work, it rarely covers what is needed. Medicaid does. Medicaid supports America's health. It insures 20% of the U.S. population. Medicaid pays for 41% of all births in the nation. It insures 39% of the country's children and 16% of adults from 19 to 64 years old. 43% of adults with disabilities are Medicaid insured. Medicaid insures 14 million people in rural America and is instrumental for preserving their local access to care. 61% of Medicaid-insured people, excluding those on supplemental security income or who are also covered by Medicare, are employed. The partnership between the federal government and states reduces state costs, especially for states with poorer economies. If you found this video informative, please share it. Look for the next video in the series and learn why the structure of Medicaid matters. Thank you for watching.